Welcome to this video about Fuchs endothelial dystrophy, a progressive eye disease affecting the cornea. We'll explore what this condition is, what causes it, how it's diagnosed, and what treatment options are available. Understanding Fuchs can help you or a loved one better manage this condition. So, what causes Fuchs dystrophy? The exact cause isn't fully understood, but it's believed to be a combination of genetic predisposition and environmental factors. In many cases, it's inherited, meaning it runs in families. Specific genes, like COL8-2, have been identified as playing a role. However, not everyone with these genes will develop the condition, suggesting other factors are also involved. Some research suggests that oxidative stress and inflammation might contribute to the disease process. To understand Fuchs dystrophy, we need to understand the endothelium. The endothelium is a single layer of cells lining the inner surface of the cornea. Its primary job is to pump fluid out of the cornea, keeping it clear for vision. In Fuchs dystrophy, these endothelial cells gradually die off or malfunction. As these cells are lost, they're replaced by abnormal collagen deposits called guttata. These guttata disrupt the smooth surface of the endothelium, and the cornea begins to retain fluid, leading to swelling, thickening, and eventually, blurred vision. Fuchs dystrophy is most common in people over the age of 50, although it can sometimes appear earlier. Women are more likely to develop Fuchs than men. While the exact prevalence is difficult to determine, studies suggest that it affects a significant percentage of the population, making it a relatively common corneal disease. It's also important to remember that many people with early Fuchs may not even know they have it, as symptoms can be subtle at first. The symptoms of Fuchs dystrophy can vary depending on the severity of the condition. Early on, you might experience blurry vision, especially in the morning, that gradually improves throughout the day as the excess fluid evaporates from the cornea. As the disease progresses, the blurry vision can become more persistent and affect your vision throughout the day. Other symptoms include glare, halo surround lights, and a gritty sensation in the eye. In advanced cases, painful blisters can form on the surface of the cornea. Diagnosing Fuchs dystrophy involves a comprehensive eye exam. Your ophthalmologist will use a slit lamp microscope to examine the cornea for guttata and signs of corneal swelling. They will also measure the thickness of the cornea, which is called pachymetry. A specular microscope is used to assess the number and shape of endothelial cells. This is a crucial test to identify the condition, even in its early stages. While there aren't distinct types of Fuchs in the traditional sense, it's often categorized based on the age of onset, early onset, and late onset. Early onset Fuchs dystrophy, though rarer, typically presents with more aggressive symptoms and may require treatment at a younger age. Late onset is more common and progression is usually slower. Treatment for Fuchs dystrophy aims to relieve symptoms and improve vision. In the early stages, treatment may involve using hypertonic saline eye drops to draw fluid out of the cornea and reduce swelling. A hairdryer held at arm's length, used to gently warm the cornea, can also help evaporate excess fluid. As the disease progresses, surgery may be necessary. The most common surgical procedure is Descemet's stripping automated endothelial keratoplasty, or DCEK, where the damaged endothelium is replaced with a healthy donor endothelium. A newer procedure, Descemet membrane endothelial keratoplasty, or DMEK, is even less invasive and offers quicker visual recovery. Unfortunately, there's no known way to prevent Fuchs dystrophy, especially if it's genetically inherited. However, protecting your eyes from injury and managing any underlying health conditions, such as diabetes, may help slow the progression of the disease. The prognosis for Fuchs dystrophy is generally good, especially with advancements in surgical techniques. While the disease can significantly impact vision, treatments like corneal transplantation can often restore clear vision and improve quality of life. Research is ongoing to explore new therapies, including cell-based therapies to regenerate the damaged endothelium. These advancements offer hope for even better outcomes for people with Fuchs dystrophy in the future.